My name is Randall Ellis. I'm the Senior Director for Government Relations at Legacy Community Health Services. We're a federally qualified health center based in Houston. We serve approximately 2,000 people a year at our Montrose Clinic living with HIV/AIDS.
Can you tell me about the Houston area in particular? You've got 2,000 people who are, a part of this program who get this medication at Legacy. How does it compare to other parts of the state?
Houston has the highest number of infections and the highest rate of infections in the state. And I think it's important to, as we put Texas into perspective of the rest of the nation, which seems to be going on a lot these days, we have one of the most strictest eligibility requirements of any state for this sort of program. And we have one of the most strict drug formularies as well, meaning that you can't earn a lot of money and there are not a lot of drugs that are available. And so you'll have to, if you earn $15,000, you have to find another source. If you need additional medications that are not on the formulary, you'll have to find another source. We went into the session knowing that we needed $20 million to keep the program whole, to keep people at the same eligibility level coming into the program, make prescriptions available for them. What the legislature said is, if you need that money, you can ask for a transfer from the Medicaid program, a program which is already underfunded by $5 billion. So we basically are being strung along and have to continue to advocate and ask for that money and ask for that transfer that we know that we'll need. Because people are living longer, people are staying on the program. Because the economy is bad, there are more people that need to be on the program. There's a greater demand for HIV medications. Are they going to ask for the transfer of funds from the HHS? Are they going to cut eligibility? Are they going to cut out some of the drugs that are offered? We haven't got a clear direction, but we know that we have some time, that we have a few months. Our next meeting is in October, and we'll continue to dialogue with the department on how this program proceeds.
Why is it the state of Texas's responsibility to fund this medication and prevention and all of these things that Legacy provides to HIV/AIDS patients?
There's two ways to look at this. One, this is a matter of public health. HIV is a communicable disease, and we know that if we lower the burden, if we lower the amount of infection that people have in their system, that we lower what's called the community viral load, or the amount of virus that's out in the community, therefore we lower the number of transmissions. Two, if the state, by getting involved and taking care of this issue before people get sick, it keeps them out of the emergency rooms, keeps them out of the public hospital systems, and lowers the cost of treating people living with HIV, which then lowers the tax burden that we pass on to residents of Texas.